Now, our next scholar is Cindy McMeans, and Cindy spends her time serving in NHS as a student ambassador, D group leader, and boys soccer manager. And she also works as a medical assistant for 4 gastroenterologists at Digestive Health Associates. Now, she's not sure where she wants to attend college, but she knows she'll study medicine. Now, Sydney is studying the negative effects of radiation in the medical field, specifically radiotherapy and cancer. Now, let's welcome Cindy McMeans.
Patient, 66, dies in 1934 from aplastic pernicious anemia, causing leukemia. Marie Curie spent her entire life on her passion, radiation. And unfortunately, her, just like many others, fell victim to its harmful effects. The one that I'm going to talk about today being the causation of cancer. Unfortunately, in the medical field, these victimizations are pervasive. And specifically in radiotherapy, this is seen all over. Now, radiotherapy is an actual cancer treatment that causes cancer. It works by using a beam of a high dosage of radiation targeted towards the area of cancer in the patient. And radiation itself causes the cancer through something called genomic instability. And genomic instability is basically where the radiation hits the cells and messes up the DNA. And from doing that, it opens room for mutations to come in and be created, which is where the cancer comes in. So first, I'm going to use grays as my unit of measurement for comparison so I can show you all some reasons as to why radiotherapy is effective. So first, we have a chest x-ray. A chest x-ray gives off 0.001 grays of radiation. And you'll all know, during a chest x-ray, or really any x-ray at all the medical professionals run out of the room, leave the patient in there, and then they cover the patient's body with lead in the area that's not being imaged. This is because they don't want the harmful effects of the radiation. Thus, radiotherapy, where it gives off, say, 40 to 50 grays, they should be exercising the same precautions. And then we have a dental x-ray. And in a dental x-ray, it gives off about 0.004 millisieverts of radiation, which in grays is somewhere in the millionth or billionth place of a decimal. And again, for a dental x-ray, as many of y'all know, all the physicians run out of the room and they cover the patient's body in lead to protect the areas that are not being imaged. And this has a much lower dose of that radiation. And lastly, we have Chernobyl. Chernobyl was a horrible incident in which a ton of radiation flew all over the surrounding area in Ukraine from a nuclear reactive explosion. Animals were deformed, and people all around, miles around, lost their lives. Chernobyl gave off around 200 grays of radiation per hour, meaning that radiotherapy, the average regimen being about 45 to 60 grays of radiation, meaning radiotherapy is about a fourth of what Chernobyl gave off in, say, an hour or 2 hours. So, how is this all relevant? Radiotherapy, the lethal dose for radiation in general, is about 3 to 5 grays, meaning that radiotherapy itself, in the whole regimen, is about, say, 10 times more than the lethal dose of radiation. Further, last number that I'm going to throw out at y'all, about 0.1 gray of radiation increases your risk of getting cancer by 1%. And you did the math. 50 grays of radiation times all that, meaning your risk of getting cancer raises by over 100%. Now, one thing that I want to ask doctors in my future research is, why do they prescribe therapies like radiation that are harmful to patients like this? Why do we want to take away one's cancer and give them another cancer in this process? Especially when there are so many different therapies that are just as efficacious, if not more. For example, chemotherapy, target therapy, and even immunotherapy are all great therapies that do work and do not cause cancer. And in my future research, I also want to look at how this radiotherapy, how we can take away the harmful effects of having cancer. There are different things called radiosensitizers. There are ways to lessen the doses over a longer period of time, and there are other ways to protect the body. I want to know why we aren't using those and how we can make those better. And overall, I want to learn how we can make the cancer treatment process just overall better for patients and more efficacious. Thank you.